Longevity drugs, should you be taking them? Now this is part 2 of our longevity drug series, and I'm going to answer that question in just a minute. But first, let's do a little review. We mentioned the drugs that have been purported to be helpful for longevity, and the top of the list is metformin, a widely prescribed diabetic drug that can reduce inflammation, cancer risk, and mimic some of the benefits of fasting and exercise. So exercise in a pill. Is that too good to be true? Yeah. So there's a study that was done a number of years back that showed that people that were taking metformin, diabetics on metformin, lived longer than diabetics on other drugs. All right, that's not surprising, but another study showed diabetics on metformin lived longer than non-diabetics, and that kicked off this whole longevity craze. It appeared to reduce mortality and improve lifespan and health span, and they suggested that it might be used as a gerioprotective agent, something to protect people in old age. So let's look at the side effects. Here's the most common ones. Half the people have diarrhea, a quarter of the people vomiting and nausea, and on down. So nothing extremely severe on this list, but quite a few different symptoms. And most of these effects are transient, so they tend to go away with time or if you lower the dose. But about 5% of all people cannot tolerate it in any dose. And I want you to remember that metformin is a mitochondrial poison. So it poisons your mitochondria, which are your energy-producing components of the cell. And by doing that to a mild degree, it makes your body produce something called AMPK. And AMPK is wonderful. It does lots of beneficial things to your body. Now, on the 7 Systems Plan course, we teach 5 simple, healthy things you can do to ramp up AMPK without poisoning yourself. Another problem with metformin is potentially having something called lactic acidosis. The most dreaded adverse event of metformin is lactic acidosis, and it can be potentially fatal. If you take metformin for a year, you have a 1 in 67,000 people chance of dying. So not a very huge number, but lactic acidosis is something serious, and especially if your kidneys aren't clearing things out like they should. So you need to have good kidney function on metformin. B12 deficiency is very common. About a third of the people that are on it long term end up having B12 deficiency. It tends to block the absorption, they think. But if you're on metformin, absolutely you should be taking B12. So what happens to energy? There's a significant reduction in maximal aerobic capacity when healthy, normal weight subjects were treated with a typical dose of metformin. So these, again, are people trying to use it for longevity. Their energy goes down significantly. Now, in some people, it's only a 3% reduction. So 3% less energy, you're not going to notice that unless you are an Olympic athlete or an elite runner. But some people have a 10% reduction in VO2 max. That's the function of your lungs. And that can be noticeable. If you're going up the steps, you'll get winded easier. And again, remember, the metformin is poisoning your mitochondria, which produce your energy, so that kind of all makes sense. Other studies on metformin and exercise, they found that metformin attenuates the improvement in physiological function after aerobic exercise training. What's that mean? You do all the work, you're on the drug, you don't get any benefit. And cardiorespiratory fitness is one of the strongest risk factors for, you want to be in good shape because that decreases heart disease and all kinds of other problems. And when they looked at cardiorespiratory fitness, they found on a placebo, you gained a fair amount. On metformin, not near as much. About half the benefit after 12 weeks of training. And what happens to the muscle mass in the body? Progressive resistance exercise training, which I want all of you to do, that's weightlifting, is one of the most effective things to combat the loss of muscle as we get older. So they had people do this for 14 weeks, and what they found was that metformin blunted the gains in muscle mass. The people on a placebo or nothing doing exercise gained 4% muscle. That's pretty good. The people on metformin, nothing. So we really need a study to see if this longevity drug is beneficial or not, right? And in 2015, the TAME study was proposed. It's going to be a 6-year study, placebo-controlled, randomized, involving 3,000 non-diabetic men and women between 65 and 80. They go through this program, and after 6 years, we have the answer. Now, that was 2015. And why do we need that? Because currently, a lot of these anti-aging things are just exchanging one disease for another. So it helps you with one thing, but it causes another problem or two other problems, and it goes back and forth. What we want to show is that if we delay aging, what's the best way to do it? So they've got approval for the study in 2015, but it never happens. And why do you think it never happens? There's no money to be made. It's an expensive study, and no one's going to make money on this because metformin is one of the cheapest diabetic drugs there is, so it still has not occurred. However, that doesn't stop Silicon Valley techies from using metformin. People in tech are increasingly taking metformin, a commonly prescribed diabetic drug, in aims to stay healthier longer. Longer life, that's what they're shooting for. There are much better ways to do that, as I'll tell you in a minute. But here's what we know from animal studies. If you just give them a small dose, just 1% dietary metformin, it actually shortens their life. Because it is a poison, it's a little too much. If you give them 0.1%, then you can get a 5% increase in lifespan. So there's a balance there, and you've got to hit that right number. And what if everyone's not just the same and doesn't metabolize it the same? For over 2 decades now, I have been quoting this study. It was a study done in February of 2002, the paper was, and they compared lifestyle changes to metformin. Now, you guys know how this is going to end. They randomized over 3,000 non-diabetics to this program. Now, these are people who have pre-diabetes. Their blood sugar's high. They're going to become diabetics if they don't do something. And they're either on a placebo, metformin, or they make some lifestyle changes. And the metformin did work. 31% of the time, the group on metformin did not become diabetic. 31%. But it tended to not work in everyone. People over 60 didn't work that well. People that didn't have high blood sugar didn't work that well, and people that weren't overweight, it didn't work that well. So it was kind of a hit and miss. And other studies have shown that metformin actually can do things to insulin that are not the best. So people who are not diabetic, who go on metformin, can have their insulin sensitivity decrease. Now, we don't want that. Of all the things in the world, you need your insulin to be working correctly and your cells to be sensitive to it. And when this group was on metformin, their insulin sensitivity decreased. Now, that's going to set up some other problems. If you look at all causes of mortality in this study, they really summarized it well. They said, it must be stressed, however, that any immediate use of metformin as an intervention for aging by the general population is not supported. I think there's too many risks. So what is the best solution? Well, we go back to that 2002 study. They had people on a lifestyle program. They didn't have a lifestyle program. They just told them, Here's 7 things we want you to do. And it was twice as effective as metformin. Twice as effective as metformin, just telling people work on these 7 things. Eating better, exercising, making a few changes like that. Here's the placebo, here's metformin, here's lifestyle changes. Twice as effective as the best drug there is. Another study, 58% reduction in diabetes, becoming diabetic if you just make a few changes. Now, it was interesting to note that these lifestyle changes worked, and they weren't on a program. They were just told, here's what you should be working on. And what were the specific things? Decreasing fat, changing your fats, more vegetables, less sugar, salt, alcohol, and get some more exercise in. Told them to do that. They told them to do that, but how many of them did that? Well, they followed up to see how many of them did that, and most of them didn't do that. But if they did just one of those 7 things, look what happened to the number becoming diabetes. If they did 3 of those things, if they did 4, 5, or 6, there's no diabetic. 100% prevented people from becoming diabetics if they just make a few changes. Now, on the 7 Systems Plan, we don't give you 4 or 5 things you can do. We give you 100 different little things you can do to not only prevent you from becoming a diabetic, but to increase your longevity and increase your health. And I've been working with diabetics for decades now. Candy was one of them. In 1 year, she got rid of her diabetes. She got rid of 100 pounds. She fixed her 7 systems. And now we are over almost 2 decades later, and she is still not a diabetic. Here's what I want you to remember. Longevity drugs may have some benefit. They do. But they all come with adverse effects. They are half as beneficial as just making a few lifestyle changes. And making a few lifestyle changes is very, very powerful. The more changes that you make, the better off you are, the more health benefits you have. And to date, nothing beats the 7 Systems Plan for preventing and reversing diabetes.